It's estimated that over 9 million employees likely lost their employer-sponsored health insurance over the past few weeks. Our great friend of the show, investment advisor JB Bryant, is joining us by Skype this morning with a few tips on how to secure your health insurance during the COVID-19 pandemic. Hey, JB.
Good to see you, Bill. And this is a very important topic because it's not discussed enough. Do you know that the majority, or I wouldn't say the majority, but about half of all Americans get their health insurance through their job? So now we have a lot of Americans, unfortunately, losing their job and losing their health insurance at the same time.
Okay, so we've heard about the politicians have been going back and forth about health insurance for years, but now
Mhm.
is this kind of highlighting that and kind of bringing this to the
Oh,
front?
very good point, because it's going to become a major issue that too many workers have to rely on their employer in order to cover their family for health insurance. So now, because they're estimating, Bill, that the cost of health insurance in 2021 is going to go up about 40%.
Wow.
40%, Bill. So employers are going to what? Stop providing health insurance because it's not going to be affordable for them. So that's a major problem when we live in a country where so many workers rely on their insurance through their job.
So
So
you,
it's gonna be a major political issue.
so you
It
say
should be.
2021 it's going to go up 40%. It's already gone up a ton in the last
Oh
year,
yeah.
hasn't it?
Oh, yes, because when you look at the information from 2019, it was already estimating that for this year, costs have gone up and it's become a problem. If you look at why people last year did not have health insurance, because millions of Americans already didn't have health insurance, and it was because of affordability. Now we have the challenge of not losing the job. Now, losing the job last year was the number two reason after affordability. Now they're at a race for the top position because it's unaffordable and job losses are on, of course, unfortunately, on the rise. So we have a major problem there for getting the coverage, but you must have the coverage.
Yeah, that's a
So
race nobody wants to see, having that race
that's
to
right.
get to that point. All right, so what can anybody do to get health insurance if they've lost their health insurance due to the pandemic?
One good thing is that it is an event. If you lose your job, it is an event that will allow you to be covered. So because of that unavoidable event, you qualify for the special enrollment period. So go to healthcare.gov. That is a good option. Healthcare.gov helps you organize all of the options available to you really through your state. It does some of the work for you. So I would say that's the first step. And if depending on the size of your family and on your income, you may qualify for Medicare. So make sure that Medicaid, I should say. Make sure you check out for the state of Virginia what is the requirement to qualify for Medicaid.
Okay,
So
so
Medicaid is for special low income situations.
yeah, that was going to be my question because I think a lot of folks know that Medicaid is for people that have fallen on hard times, that have children,
Yes.
and has that kind of increased because of the pandemic?
I've even seen major marketing by the state of Virginia promoting their Medicaid program, encouraging you to participate in it or find out and get more information. One thing though, if you do qualify for Medicaid, you will get help through healthcare.gov. They will send your information to Medicaid for you. So healthcare.gov, I would say, is probably your first stop. Go in, find out about the special enrollment period. You must do these things within 60 days. So, unfortunately, Bill, when you're going through a time of crisis like this, it's very important that you don't freeze. Your family is depending on you to get this protection in place. So, I hope that this discussion will encourage someone out there at home. Don't let time go by and let 60 days of not having coverage go by. Then you will not qualify. But go now to healthcare.gov, get the information, shop the options, and it will help you find out if you do qualify for Medicaid as well. And know that you can shop around. So it will give you at least like 5 or 6 different options of high deductible or different things, to have lower out of pocket or have no cost for doctor visits. And depending on your specific family situation, you can try to discover something that is affordable. But we have to take that first step to protect yourself, because the costs associated with even COVID-19 are very expensive. Now, in Congress has said that they cannot charge anyone for getting the exam or the test. So free testing is available for everyone. Well, if you are diagnosed with COVID-19, the expenses associated can be very expensive, and you don't want that stress, because research says that if a person doesn't have health care, they're less likely to go to the hospital and get the help that they need. So do it now while you're healthy, get information, and indeed, hopefully, you will stay healthy, but because you will have less stress by checking out the healthcare coverage at this time.
All right,
And
JB.
share the information with your family as well, please.
Thank you,
Definitely.
darling. Always great information from you, and thanks for helping out families in Central Virginia as much as you do. That's our good friend JB Bryant. She offers free weekly money seminars and webinars every Wednesday and Sunday. You'll find a link for more information at WTVR.com/VTM. Stay tuned. We'll be right back.